orthodontic treatment, or if your child was a Phase 1 ortho patient, we may refer to this as Phase 2 orthodontics. The goal of full orthodontic treatment or Phase 2 treatment is to position all the permanent teeth to maximize their appearance and function. Orthodontic braces are often used to correct malocclusions such as overbites, underbites, crossbites, open bites, deep bites, crooked teeth, and various other flaws of the teeth and jaw. Braces are often used in conjunction with other orthodontic appliances to help widen the palate or jaws and to otherwise assist in shaping the teeth and jaws. Orthodontic treatment is best accomplished with full braces and is usually around 18 to 24 months long. This can take more time if we continually break parts of our braces and/or miss appointments. Typically, we will see you about once a month for adjustments until we are ready to remove your braces and move to the retainer phase. Let's go over some orthodontic terminology. This is helpful if you have a question or problem at home. You can explain to an assistant over the phone what is happening with your braces. Arch wire, the metal wire that acts as a track to guide your teeth along as they move. It is changed periodically throughout treatment as your teeth move to their new positions. Band, a metal ring that is cemented to your tooth and goes completely around your tooth. Bands provide a way for the arch wire to attach to your teeth. Bond, the seal created by orthodontic cement that holds your brackets, bands, and appliances in place. Bracket, a metal or ceramic part cemented to your tooth that holds your arch wire in place. Coil spring, a spring that fits between your brackets and over your wire to open space between your teeth. Elastics, a small rubber band that is hooked between different points on your appliance to provide pressure to move your teeth to their new position. Elastic tie, the rubber band that fits around your bracket to hold the arch wire in place. These come in a variety of colors. Hook, a welded or removable arm to which elastics are attached. Ligature, a thin wire that holds your arch wire into your bracket. Mouth guard, a device that protects your mouth from injury when you are participating in sports. Palatal expander, a device that makes your upper jaw wider. Retainer, an appliance that is worn after your braces are removed. The retainer attaches to your upper and lower teeth and hold them in place. Some retainers are removable and others are fixed. Spacer, a small rubber ring that creates space between your teeth before the bands are attached. Wax, wax is used to stop your braces from irritating your lips. Today you will be given special toothbrushes, toothpaste, floss threaders, wax, and instructions on how to use all of these items. When you are brushing your teeth, clean each tooth individually. First, place your brush at a 45-degree angle to conjunction between the tooth and the gum. Then apply gentle pressure as you move in circular motions. Do this for about 10 seconds. Use the same brushing action on all outer teeth and inner teeth surfaces, tilting the brush as needed to better reach the insides of smaller front teeth. The brush on the end of the toothbrush is for you to be able to go up between each bracket and to get anything out that is under the wire or bracket. Use the tool instead of a finger to prevent breakage. You must floss a minimum of 1 time a day. You may also do this more frequently. Rinse thoroughly with water or mouth rinse and examine your teeth and braces in the mirror. You do not need to be a dentist to recognize the difference between clean or dirty teeth. Your teeth should sparkle, shine, and feel clean. You can buy a water pick to help flush out any food that can get caught underneath your appliances, brackets, or wires. This is only an aid and does not replace brushing and flossing. We will be sending you home with prescription toothpaste that has extra fluoride in it. This helps prevent any scarring and decalcifications around your brackets, bands, and wires. Use it morning and night when you brush. You only need a pea-size amount. It is a large tube and should last a long time. Take a small travel-size toothpaste to school or work to brush during the day. Here is a photo of a patient who did not brush well and left food, plaque, and debris on the teeth and brackets daily. You can see all the scarring on the teeth visibly after the brackets were removed. This does not bleach out or go away. It will eventually turn into decay and cause a lifetime of dental problems. We will inspect your teeth at each visit for cleanliness. Patients with repeated appointments with poor oral hygiene may be taken out of braces early to preserve the health of the teeth. Foods to avoid. We are putting a lot of very expensive equipment in your mouth today, and you must take very good care of it to prevent things from breaking. Eating things you are not supposed to is the quickest way to break appliances, brackets, bands, and wires. Keep in mind, if you break or lose any appliances, your parents have to pay for a new one to get made. You cannot have anything too chewy or sticky, so that means no gum, caramel, taffy, or any other sticky treats you can think of. You must avoid things that are hard or crunchy. This includes foods like popcorn, ice, chips, or even a hard pizza crust. You will need to avoid biting into things like corn on the cob, apples, and hard veggies. You can still have these foods by cutting them up into smaller pieces and chewing them with your back teeth. If you have to think twice about if you should or should not have a certain food, then it is probably best to just avoid it. Along with food items, you must not play or chew on things with your appliances, brackets, bands, or wires. You must avoid chewing on items like pens or pencils at school, and if you bite on fingernails, you must stop these habits as well. Movement of the teeth. Teeth movement is normal, and teeth may feel slightly loose while a patient is in any orthodontic treatment. Do not wiggle on any permanent teeth or try to pull out any brackets, bands, wires, or appliances unless given specific instructions. Teeth will tighten back up as the patient is moved into thicker, heavier wires throughout their orthodontic treatment. General soreness. It is perfectly normal to have some soreness and discomfort with any orthodontic treatment. You are getting a lot of new hardware in your mouth that you are not used to. Do not get discouraged when you are eating. Just stick to softer foods like pasta, pudding, and mashed potatoes until you get used to chewing with your appliances in. You may take ibuprofen or children's Motrin for a couple of days to help with any discomfort. Please read all packaged instructions based on age and weight when administering any medications. Soreness and discomfort will get better as treatment continues, so hang in there. Sometimes discomfort caused by a wire on your braces can be resolved by moving the wire away from the irritated area with a cotton swab. If the wire will not move, try covering the end of it with a small piece of cotton or a small amount of wax. If the wire is painful, you can cut it with fingernail clippers or small scissors that have been washed and sterilized in alcohol. If you cannot resolve the problem, please feel free to call our office for an appointment. If you play any sports, please let us know and we will provide an athletic mouthguard for you. If you prefer a different kind of store-bought mouthguard, please bring it in to your next appointment for approval from your doctor. We recommend a mouthguard during all sports with or without braces to help prevent any accidents. Retainers. At the end of your treatment, you will receive retainers to prevent any relapse. We will send you home with specific instructions at that time. Sometimes discomfort caused by a wire on your braces can be resolved by moving the wire away from the irritated area with a cotton swab. If the wire will not move, try covering the end of it with a small piece of cotton or a small amount of wax. If the wire is painful, you can cut it with fingernail clippers or small scissors that have been washed and sterilized in alcohol. If you cannot resolve the problem, please feel free to call our office for an appointment. Lost spacers. Most patients lose a spacer during their treatment. Do not worry about losing a spacer, but call our office to see if it needs to be replaced. Call our office for advice if a bracket, band, or wire is loose. The bracket or band may just need to be rebonded or re-cemented. You may have a situation that requires cutting a wire or sliding a bracket off of a wire at night or over the weekend. If you need to cut a wire and in case of an emergency, you may use fingernail clippers or small scissors that have been washed and sterilized in alcohol. Please call our office the next business day so that we may schedule your appointment.